we're probably starting to get a few calls about herd health right now, like cows that are starting to display signals or signs that something else is going on. What sort of things are we looking out for at the moment? What are lads asking you, Dennis, at the minute?
Yeah, I suppose surprisingly enough, there's a little bit of talk about coughing cows already. Tis very early. You mightn't think it, but lungworm is a possibility. And speaking to some vets last year, certainly that did early lung washes, they actually picked up lungworm larvae in the washes in early enough May. So I think you need to be aware of that it could, lungworm could be a possibility at this stage. I suppose another one is pica. That's another thing that has been increasing in the last couple of years. So that's cows licking earth or licking stones. And I suppose the main culprit there is probably phosphorus deficiency, Martin, isn't it? And is there enough phosphorus in the ration? And a lot of it probably has to do with the amount of grass we're growing, doesn't it?
Yeah, I mean, I think, and pica and the term is becoming a bit more common. I mean, I had a call there last week. A farmer, he was talking about his heifer group on an outblock,
really?
And he couldn't believe it was going, and they were actually physically picking up quite large stones at the side of the field, and they're eating these. So digging into it a little bit, he's probably at index 2 in those fields. Probably didn't do any liming maybe the last 10 years. So lime status is poor. P status is poor, so overall uptake is going to be poor. And again, if we combine that with weather conditions that we've had, where we've had a lot of cold nights, a huge variation in grass growth, and now a sudden surge, we could be really, really short on the big minerals. So before I start worrying about all the little stuff, and look, copper deficiency happens, of course, molybdenum toxicity, all these things, but before I start worrying about those, I will look at the big minerals. So it's very simple, I think, with phosphorus. We can, in that heifer situation, going to put in some licks. You can put it into the water, and certainly with the cow situation, a lot of the mills are very happy about maybe doubling the phosphorus rate inside in the rations. Unfortunately, it's not in the label. You need to talk to the nutritionist or whoever's doing the compounding inside in the mills, and they'll tell you how much phosphorus you've got knocking around in there.
And I suppose another common enough health event, maybe it's not a health event, but fat starting to drop this time of year. We're going into second rotation grass. Those oils can be high in the grass, the fibre is a bit low, and you see fats start to drop. You have a lot of experience in this, Martin. What is there a solution, or do you just live with it, or what do you do?
It's like we can really get into, do you start adding in a lot of different ingredients into your concentrate? But a lot of the farmers at the moment, like, they're feeding quite low levels of concentrate. They're trying to carry enough magnesium to avoid detonate. That's number one. Get the phosphorus right. Number two, make sure there's enough calcium in the ration. So you stop these crazy milk fevers that sometimes happen out in early lactation. Like the grass will go through its stages, and it will grow out of it. You will go through a period of possibly 4 to 6 weeks, depending on the farm, the way the farm is set up in terms of grazing. So if the cows keep holding their weight, the protein is good, they're going in calf, they're doing everything right, I'm very reluctant to start trying to change the system. Some herds genuinely will get into stomach problems where you have cows with, a lot of scour, they're losing body weight, or the protein is dropping as well. Those herds will start coming in, and maybe, we'll look to try and adjust the rumen a bit with some high quality silage, something like that. But I really have to have enough signals from the farm to tell me to do that.
So if cows are healthy, they're in good body condition, the protein is good, which is your main indicator of energy or negative energy balance, and the dungs are pretty normal, and the cows are healthy, you're inclined to ride it out without
I am inclined to. I'm inclined to, because we can get very caught up in trying to change something, and we'll shift the fat by maybe 0.1. It won't shift dramatically, and so a lot of effort goes in to do that, as long as the cows are telling us they're okay. So the signals are important, and sometimes what happens, I think, when you're so used to seeing your own cows the whole time, you lose sight of it. It's a great advantage of discussion groups. You get to see other people's cows and they pass comment. But also it's real handy. Again, vet in the yard, advisor in the yard, someone else, get them to have a look at the herd. Walk through for 10 minutes. They often give you a very objective view.
A different set of eyes.
Set of eyes, absolutely.
So some roughage available or not? That's a common question farmers would ask. Should you have some roughage available at a barrier or a circular feeder if you can?
I think if they're in genuine need, first of all, we're going to put out silage, and if we're going to get a lot of cows to eat that, they're going to be short and dry matter outside to get them to eat enough quantities. Like a bale a bale of silage, and let's say there's 200 kilos of dry matter inside it, and you've 100 cow herd, and that bale takes 2 days to go away. They're eating a relatively small amount.
It's a kilo a day or something like that.
And they'll probably do it on the way in and out. Often people talk about, well, if a cow needs it, she goes for it. I'm not terribly sure about that, because even with our own approach to diet, we don't necessarily go for the things that are good for us. So cows will always go for high palatability feeds. What you'll find is subordinate cows often go for alternative feeds somewhere else where they're getting away from cows. So I'm not just convinced that popping a bale into a ring feeder is always the answer. I prefer to put out a barrier and give people a chance, or give the cows a chance to eat it.
Yeah. And I suppose another question you'd get this time of year, and this is probably to do with our own herd health results that are due out pretty soon now in the next week or so, is, people have forgot to do the vaccine, maybe the lepto vaccine or the IBR vaccine, and they're wondering, jeepers, I'm starting breeding now, should I do it or should I wait, or what should I do?
Yeah. Look, and you'll get lots of mixed opinions about it. In general, there was quite a view that giving lepto vaccine may have an impact on conception rates and so on. Probably our advice is, particularly I suppose with lepto vaccine, not inclined to go in right bang in the middle of the breeding season with it if we can avoid it. Or BVDs, leptos and so on, we like to have them done beforehand. A lot of people are set up on IBR, they're doing IBR live January, June. So they're generally hitting into kind of, that third period of breeding. And there isn't a problem with that. There's no licensing that says we shouldn't use it during the breeding season.
Even though it's a live vaccine, I don't see any.
How do you feel about the lepto yourself? I mean,
sure, ideally you'd like to have it done.
Yeah.
But if it's not done, I tend to tell people to wait, especially if there's nothing alarming going on. The bulk milk results look okay, just to wait. It might mean you have to give 2 shots instead of 1 when you do it at the end of the breeding, but that's not the end of the world,
Yeah, and I think it's a fair point, actually. And again, we got a call in, just a guy, first tank this season. He's been testing the tank since 2013. He's turned positive lepto now in the tank.
Yeah.
He thinks he may be seeing some signs, or his vet certainly thinks he's seeing some signs. I actually think it's probably reasonable to get in there and vaccinate before.
That is a different story.
Yeah, you've got a disease situation, and I think the risks are sort of, the risk is far outweighed by actually getting a vaccine in. Yeah.
And every year we see it, actually, a nice number of herds that turn positive in the lepto bulk tank at the first test of the year. And often, well, the main reason I'm attracted to it is they're actually seeing clinical signs in the herd. Not necessarily fertility, but cows out of sorts, bits of high temperatures, and often mastitis, whether it is leptomastitis or secondary mastitis coming from low immunity. So I think it's a key one to get to vaccinate for.
Yeah, absolutely. And it's hard to tease out, and it can be quite hard to diagnose it as such. And sometimes vets in practice, when you're on the road and you're faced with these herd problems, getting a real complete diagnosis is often a real challenge, because some of these diseases, they're quite sneaky, and even though the bull tank is not ideal, it's maybe poor with lepto to tell you what sort of clinical picture it's giving or what the future might be. But certainly a positive in an unvaccinated herd should never be ignored. And I think it is a very, very useful way of monitoring those herds that aren't vaccinated for lepto. Yeah.
So some of the other ones then that are coming out, Neospora is coming, lepto, Ostertasia, or stomach worms. So we're actually doing that in the first test for the first time now. We haven't done it before, so it's a bit new to us. So I suppose the theory is we're going to look at how they came over the winter. If they did get dosed for worms for the winter, how did they come over the winter? And hopefully we'll see a drop from the last test last year to the first test this year, similar to the stomach or to the liver fluke, I suppose, to see did you get a cure over the winter. And the IBR is in there as well, so that's
so it's a good start off picture. I think it's important to note with lads, I mean, they often look at the stomach worm piece and there's a bit of confusion between stomach worm and lungworm there. We're not measuring for lungworm in the tank, isn't that right, Dennis?
It is, yeah. So it's stomach worms. The best way to measure for lungworm really is your eyes and your ears, are the cows coughing. So listening and watching them, that's probably, and then if they are, I think, get in touch with your vet and maybe organise that lung wash, because that is the definitive test. And you don't want to be rushing in dosing willy-nilly. We're trying to reduce the dosing and really use our diagnostics to try and target the dosing when we need it.
Yeah, but look, some of those herds, lungworm is a problem and they will hit the yield dramatically. So dosing is going to be necessary, definitely. Yeah.